The following is not a paid advertisement.
How are you?
I'm good. How are you?
I'm good. Tired.
How was last night?
It was pretty good.
What'd you do?
I went out, didn't get home until about 5 o'clock in the morning, but you know, it's okay. How about you?
Wow. No, I went out, but I came home at 1.
Oh, that's good.
Yeah.
Yeah.
So what did you do?
Stuff.
Oh, okay. That's cool.
Yeah. Did you hear the... Did you get a horse?
No, that's Melvin. He's having a problem with his mucociliary escalator.
Oh, Molly, that's
Elevator.
not good. Having a functional mucociliary elevator is one of the required components of airway clearance.
I know, Sally. Along with patent airway and an effective cough, a functioning mucociliary elevator is a requirement. I just don't know what to do for him. Poor Melvin.
Why, Molly McMucus, why don't you get you one of these?
What's that?
It's the Vestomatic. It's a high-frequency chest wall oscillation therapy device.
Oh my, what does it do?
Well, Molly, high-frequency chest wall oscillation therapy, or HFCWO therapy, uses pressure pulses to the thoracic cage via a pneumatic inflatable vest, like this one. The patient applies the chest and connects it to the air pulse generator, which rapidly inflates and deflates the chest. The alternating inflation and deflation causes oscillatory pressure pulses 5 to 25 times per second to be transmitted throughout the thorax. The pulsing facilitates removal or retained secretions, and you can use it at home for airway clearance therapy.
What?
The Vestomatic will vibrate the heck out of Melvin's chest and loosen all that crap up in his lungs so he can hawk it up.
Oh, I see. Is it hard to use?
Of course not, Molly. Let's watch these respiratory therapy students from Carrington College demonstrate.
Let's watch as this respiratory therapy student demonstrates the correct way to administer high-frequency chest wall therapy to a patient in a hospital. First, she verifies the physician's order and scans the chart for relevant information. She needs to make sure the patient does not have any contraindications such as hemoptysis, untreated pneumothorax, or unstable chest wall fractures. She also checks for recent results of blood gas analysis, x-rays, and any other information that will help assess the patient's current pulmonary status. Now she has a good frame of reference before meeting her patient for the first time. Next, she performs proper hand hygiene. Now she checks to make sure she has all the necessary equipment. Vest? Check. 2 large diameter tubes? Check. Air pulse generator? Check. She's ready to go. Let's listen as she introduces herself to the patient and explains the procedure.
Hi, my name is Brianna, and I will be your respiratory therapist today. How are you today?
Good.
All right, I'm here to give you your treatment. Well, I think I think you'll feel better in a few minutes. Have you ever had therapy with a vest before?
No.
Alrighty, it's very simple. I'm going to put this vest on you and then connect it to that machine. When it is turned on, it will inflate and the pulse and vibrate your chest very quickly, which will mobilize the secretions in your lungs. Are you ready?
Mm-hmm.
Okay.
The therapist will position the patient for therapy, which is sitting comfortably erect with the chest in good position for expansion. She selects the proper vest size and assists the patient. The head and arms should be able to move freely, and the vest should not ride too high or too low on the chest. Then the hoses are attached. Before starting therapy, she puts a pulse oximeter on the patient's finger to monitor her heart rate and oxygen saturation. While she does this, she notes the patient's respiration rate. She will monitor the patient closely during the therapy. Okay, she sets the controls correctly. During the therapy, she will assist and coach the patient as needed, periodically having the patient cough. It's time to start.
Okay, it's time to start. I need you to relax and take slow, deep breaths. You should cough when you need to, and if it is hard to cough with the machine running, let me know and I will turn it off. All right, you ready? Do you feel like coughing? Not yet? Good, you're coughing. Do you feel uncomfortable? No? Good? Okay. Got 6 more minutes.
Okay, that's good. The treatment is complete. The therapist will disconnect the equipment, check the patient's respiration rate, heart rate, and saturation, and ensure that she is stable and comfortable. Then she will document the events of the therapy session in the patient's chart.
The Vest-O-Matic can be helpful to patients with these conditions. And it is available in several styles and sizes.
Did you see what Steven got on his test?
Yeah, didn't he get like a 99% and then at home he got like a 98%?
Probably. I don't know how they get such good grades.
I know, I'm always about to fail.
Seriously.
I don't get it. Is that Melvin again?
No, we actually got a horse.